Want to welcome everybody to Shorts with Schwartz. We in Colorado are out of our deep freeze. How's everyone feeling today now that it's above 0 degrees?
Warmer.
You
Pretty
know,
good.
pretty good. I feel like I finally thawed out. The first couple days were incredibly tough, and my daughter was with me, which meant had to figure out every indoor activity that Denver had to offer between Friday and today, essentially. But yeah, we visited Hammond's Candy Factory. We went to some museums. We swam in pools. You got to do those things. So it was a lot of fun. But yeah, we're out of the deep freeze, and I want to welcome, and it sounds like I'm in a room right now because I am at Frontline Public Affairs with Lisa Ward and Jennifer Miles. They are our lobbying team for the Colorado ASC Association. And you may have heard during my interview with Rebecca Craig, I had quoted Lisa in our initial interview that we had about her excitement over policy in 2024, but not the politics of 2024. So I just wanted to reinforce that because I do feel that that is not just a theme for our local state politics, but I feel like that is a theme that we will be engrossed in for the next year or so as we inch towards federal politics as well and elections and just the general state of the world. But before we get into uh, talking about healthcare politics locally and healthcare policy, Lisa, I'd love to get to know more about you. And I think our membership and those that are involved with the association really understand how lobbying impacts their day to day for the most part. But what they don't know and who they don't know are the people behind the relationships, the discussion topics, the key points that when we're interacting with the Colorado Department of Health and different regulatory agencies. I don't think they necessarily understand how engaged and involved our lobbying team is, along with our legal team and our leadership of the association. So, would love to know a little bit about more about you, your start in healthcare, if you're not from Colorado, how you got to Colorado, but uh, would love to learn more about you and your passion behind healthcare, and why you got into politics.
Sure. Thanks, Simon. Thanks for having me. Happy New Year. I started working in healthcare as a ski patroller on the East Coast in Pennsylvania. So that's how I started working in healthcare. I'm an emergency medical technician. So I work on the front lines of healthcare and in healthcare policy as your lobbyist. I started working on a ski patrol in Pennsylvania, and I decided that I really liked being a ski patroller. I didn't so much like being in college, so I quit school. I had $500 in my pocket, and I got on a train and I moved to Vail.
Wow.
So I became a ski instructor in Beaver Creek, and I started working in the emergency department at Vail Health, what is now Vail Health, as a bit of a side hustle at that point. That was my side hustle even then.
That was your means to get on the slopes.
It was, and it provided health insurance. It was kind of the real job. I worked full time as a ski instructor, and in the summertime I worked as a raft guide. I just did the thing. But I always had a job as an emergency medical technician or an emergency department technician, as we're called, inside the ER. So I continue to do that to this day. I still work in emergency medicine as an emergency medical technician. I just worked this past Saturday night in the emergency department at Denver Health. And so it really gives me a different perspective when as a member of a lobbying team that sees firsthand what the cold weather does to our unhoused neighbors and to substance use and to all of the things that happen in the street, and then kind of bringing that perspective into how I work in policy and
Ab-
how I work as a lobbyist.
Absolutely. I'd love to hear a little bit more, about the passion with healthcare and the passion with interacting, obviously with patients is there. But would love to hear more about where the interest in policy came. Obviously, in the last 4 days, we've all experienced the deep freeze, and in watching media, understand how especially we have a migrant population that was dealing with that as well. But I think it's important to understand where, even before that, where did the passion come with policy in healthcare?
I've always had a specific interest in policy. I have worked for the Colorado Department of Public Health and Environment in their EMS and trauma division. I started a healthcare initiative in Eagle County for paramedics to do physician referred home care, and not just acute 911 care, called community paramedicine. I started the first program in the nation for community paramedics. So I've always had an interest in the policy angle of healthcare. Almost a geek, if you will. I've always had that nerdy kind of policy brain. And so several years ago, around, gosh, I guess it was 2017 at this point, I had been working full time in the emergency department. And quite honestly, it was emotionally and physically exhausting, and I couldn't do it anymore. Not full time. At that point, I had been working full time or part time in emergency medicine for about 25 years, 24, 25 years. And it takes a toll. It takes a toll on you emotionally, um, and physically. And so I had to figure out another way to take care of patients. I didn't want to give up the patient care aspect. I'm a caregiver. I care for people. I come from a family of caregivers. And so it was important to me um, to continue to care for patients in a way that wasn't beating myself up, if you will. So I decided that I also had a love for policy. So how could I combine my clinical bedside knowledge with my interest and my experience in policy?
So what do you think? And I apologize for interrupting, but what do you think that has done, especially in the last few years, engaged with our community as ASCs?
Hmm.
Where do you think that impact has made its mark as you've engaged with the Colorado legislature on behalf of surgery centers?
I think that that experience affords me some credibility with legislators, with associations, with members, with patients, with the community that perhaps not all lobbyists have. Is to say, when a bill comes in front of me and I understand what that looks like and what that feels like at the operational level and at the patient care level, to be able to speak to that in a way that's meaningful. I think that enhances my ability to build relationships with legislators in the healthcare space.
Credibility and validity are incredibly important things when it comes to policy and politics.
Hmm.
I want to jump into that before we hop over to talk to Jennifer for a little bit. But being excited about policy and not the politics, do you mind touching on that for a couple of minutes? Because I definitely have a couple questions, especially when we talk about the value of relationships. I just love to think about what is polarizing people do, and we mentioned civility in politics. So if you take a minute and just chat about that quote, and maybe how it plays a role into engaging in 2024, 2025 even, and your hopes related to it.
Yeah, I mean, as I've mentioned before, there is a big focus on civility in the legislature this year, more so than I have ever experienced. I certainly have not been in this space as long as my colleague Jennifer has, but and she may be able to speak to that. But it does take a big toll. I mean, it's working in the legislature and with the legislators can be, just as the emergency department is, emotionally and physically exhausting. And we have a job to do. We have a job to represent our clients, to represent their interests, to understand the policy in front of us. And that job is hard enough. And then you add in all of this, uh, rhetoric and infighting and
In Yiddish, we have a term called mishigas.
whatever that is.
There you go. just means a
I
whole lot
like
of
it. Like,
commotion
yes,
around that
exactly.
doesn't allow you to focus on the task at
And
hand.
I mean, and you we expect some of that. It is
Yeah.
chaos. The legislature under the Gold Dome is you know organized chaos. We understand that that's what it is, that's what it looks like, but it feels different this year. It feels heavier. It feels like that aspect of it is is a priority over what should be a priority.
The politics are becoming more of a
Yes,
priority than the policy.
yes, exactly. And some people really think that that's fun. It, I said to a I said to another client of mine recently, it almost seems that when I walk in through security into the Capitol, I hear this circus theme in my head. Do, 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 do. I mean, and that's kind of what it feels like, because we're again, we're trying to do a serious job.
Hmm.
Policy is important. And when I was leaving clinical bedside care full time, I really had a difficult time with that because I didn't feel like I would still have that impact. How do I still have an impact on people without physically touching them? And so I asked one of my physician colleagues that very question. How do I for lack of better terms, how do I live with not touching people and really understanding the impact at that time? Because when you touch a patient and you help a patient and you get them through their surgery or you get them through their anxiety of pre-op or whatever the case may be, um, you have instant results. You know that you have done something well. You have done good. So how do I still have that same impact in policy? But the answer was,
It's
sure.
like New York.
Yeah, exactly. The
We're
answer,
talking about the banging you may hear in the background. It is a definitely an oil furnace, and we're hearing the little bing. So if you hear that in the background, it's all good. We're safe. It's just getting warm in the room.
yes, we call that Yukon Cornelius at work.
Sorry to interrupt, but yeah. So the physician who kind
Yes,
of led you had talked about policy and
yes, and said like, look, Lisa, sure. We have 57 beds in this emergency department. Let's say you touch 57 patients a day. Obviously, in 12 hours, we touch more than that. We typically see around 200 patients a day. But a good piece of policy touches a lot more people than that.
that's I mean that's a huge statement. And I think that when you talk about credibility and impact, at least both of those, and you talk about civility, the outcomes of an individual, uh, even small, can create huge waves.
Hmm.
And I think that the physician that you were working with was like, look, you're touching a lot of hands and you're making impact, but imagine the waves of policy. And I
That's
think
right,
it's
exactly.
incredible. It's
Yeah.
incredible. I wanna jump over because it's been mentioned a few times, the terminology of relationships, and the other person that is joining us today on this podcast conversation interview is Jennifer Miles, in which our members have seen you a bunch. And we always refer to the team of Miles and Miles with our lobbying and our legal. But folks, I don't think have had a chance unless they've interacted with you one on one, get to know who you are and your pathway. But I think first and foremost, a great way to kind of bring this up. We said the word a whole bunch of times. Our relationships.
Mhm.
This business, your business, is a business built on relationships, and it's built on your credibility, your validity, all the things Lisa was talking about. You've built a business and you've been successful, and I can say on behalf of CASCA, but obviously your other clients as well, in managing those relationships. So would love to hear kind of your professional pathway, because I know we are healthcare, but you're engaged with healthcare in other levels, and I believe students, or there was a time you've had clients kind of across the spectrum in policy. So I'd love to kind of hear that pathway, and also similar to Lisa, why is healthcare important to you? I do believe it's important to everyone just because it's healthcare, but you're building a business on it. And I think it's important to understand both those relationships and that element and how it shapes you as a person.
Yeah, absolutely. Thanks for having both of us, Simon. It's great to be here and talking to you, and knowing the CASCA members will hear some of this. Um, my path is not that dissimilar from Lisa's in some ways, except that perhaps earlier in my career, I reached a point where by the time I'd seen the 10th person with the same problem, I wanted to know why someone didn't do something about the problem. My background's actually in social work. I have a master's degree in social work. And even all the way back in graduate school, I was having those thoughts and began to focus pretty early on policy, but really wanted to focus on policy that affected people and their lives. And that's where that social work background, I think, comes in. So the name of our firm is Frontline Public Affairs, and we truly do have a social worker and a EMT who are now lobbyists on our team.
The
So
front lines.
that we're from the front lines. And that definitely and absolutely influences everything about my business. So that was many years ago now. And I started lobbying in my role as a staff person, an in-house staff person for an association of healthcare providers. It was the Association of Community Health Centers, also known as federally qualified health centers. So after being there for 9 years as their director of policy and doing their lobbying work in the state and in Washington, D.C., I decided to start my own lobbying firm, and really did want to expand that firm to other clients like CASCA, other healthcare providers, where the relationships and the knowledge that I'd built over those years could be put to use to help them reach their goals as well. And some of that is just the process and procedure at the legislature of how you get a bill through. But a bigger part of it that you alluded to, Simon, is the relationships that you build over time. Working with people on a policy issue. For example, right now we're working with the state Medicaid agency on increasing reimbursement for surgeries provided in surgery centers for Medicaid patients. I bring to that decades of relationships with people who work at Medicaid, with people who set rates for other types of services, um, working on other issues similar to that for different types of providers. So those relationships and that knowledge we bring to bear to help the most recent issues get through.
So I have a question just related to the relationships and obviously building the business around those relationships. But we're talking about election seasons coming up. What are the ups and downs like when it comes to legislatures changing face? I mean,
Mm.
when I got started in politics, Colorado was a red state, not purple. It was a red state. It was very much, yeah, on the social level, pretty cool. But when it came to the fiscal and business operations, most people were in R.
Mm-hmm.
And yes, that was 20 years ago. Obviously, things change. But as a business, that the relationships are the most important part. And one year, it's the most valuable relationship, and the next year, that person doesn't exist anymore. How
Yep.
does that play for? And I know this isn't specific to healthcare, but we've got listeners that are business owners. This is the type of stress that as business owners, what's it like not only dealing with that, but also at the same time having to have the results that your clients are looking for with brand new people in the legislature.
Those are really good questions, Simon. A lot of people don't realize this, but we have term limits in the state of Colorado. So people who run for our state legislature can be in the House of Representatives for up to 8 years, which is 4 terms, 2 years each. They can be in the Senate for up to 8 years as well, which is 2 terms of 4 years each. The maximum someone therefore can serve would be 16 years if they manage to string together 8 in the House followed by 8 in the Senate. It's becoming more and more rare that people even get to 16 years. So it's not uncommon for us to have legislators who are newer and to have as much as a quarter of the 100 legislators turnover with each election cycle. So we are constantly getting to know new people. I will say that of the new legislators that come in, there is a handful whom we already know before they even run because they've been involved in policy work on some level before. That might be at a city council level. That might be on a board of county commissioner level. It could just be that they've been an advocate working on policy in some arena before they decide to run for office. But we consciously work to build those relationships every election cycle and even in between. This year, we've had a couple of vacancies and we've had some mid-cycle changes in members of the legislature. So one of the things that we do is go around the state to their districts and meet with them, sit down and have coffees and find out more about them, tell them about our clients and our interests and our background, and just build those relationships.
So I love that you brought that up, but because I want to talk a little bit about how our members can engage with you, and I think that that's one of those ways, right? We've done the tours. I think people seen the photos. They've led the tours. There's a number. I'm going to guess that the folks clicking on the links, those are the folks that are engaged and involved. But we've got a lot of people that are listening that are not from Colorado.
Mhm.
We have a lot of vendors in the industry that are listening. But what I would say is they're just as much kind of in this game as anybody else, because if our surgery centers aren't doing surgery, their products and services aren't being used. How do these, because I brought up the ups and downs. You said it's a constant job. You're meeting for coffees, you're meeting for this, that, you're bringing them to events that are related to the industry so that they continue to learn.
Yeah.
But can our members engage on that level?
Absolutely. And we advise that they do. And we have helped set up legislator tours to surgery centers. In addition to that, which is something we can help you with. So listeners out there who haven't had that yet, reach out to the CASCA team and we will be happy to help set up something like that. But most legislators have email lists. They have town hall meetings locally in the community. And if you can get on your legislators' email lists for the service area your surgery center serves, you can be invited to events where they are there, where they come to talk about the bills they're working on, where they come to hear from constituents and people in their community about what matters. And so we advise people to figure out who those folks are, get on those lists, and consider attending things locally. Um, Usually, as well, legislators are happy to talk to constituents who come down to the state capitol during the legislative session in particular. Um, and so we can help facilitate that kind of thing as well. But I think it's a lot of people think of members of Congress when they think about who they need to get to know because they operate a business in a certain community. But you really need to think about your state legislators too. They are making key decisions and can be advocates for you and your industry, especially once they come to visit. When they see it in action, it seems to sink in even more so.
Got it. So I'm gonna move the microphone right now in between both because I I'm in the world. Lobbying is the schmoozing world, right? And networking is the schmoozing world. And I think that one of the things, especially post COVID, that comfortability is not completely back is with networking and socializing. And one of the things I did want to bring up and the importance of whether it's a tour or joining it is specifically networking and growth. Has nothing to do with healthcare necessarily, but as two individuals, one that's built their career through the outdoors and then engaging within the healthcare and finding out one touch has a ripple that can be bigger to somebody else that started in social work, how and has built a business based on a network. Talk to, and I'd love to hear from both of you about what you feel the value is in engaging with individuals like yourself, because I can sit here and give 5 bullet points that spending 30 minutes of meeting with each of you at a CASCA event brings that opportunity that maybe in the future you'll introduce me to somebody. And again, I'm not speaking, I'm speaking at this as a personal growth, almost a coaching element, right? How does the value of engaging with, whether it's you two, Jim, these are people that you are all people that are making waves within the industry. How do you see it can make somebody who's an administrator at a facility or an operations manager or a GP, someone in charge of the GPO? How does this network help you grow as a person?
Yeah, first of all, I think lobbyists sometimes have a bad reputation. We're not bad people. We're not out there to be intimidating. We're there to help you as our client to make those connections. That's our job. That is the job.
And Lisa, I just want to reaffirm when you say you as the client, they're not talking to me, Simon Schwartz, Associate Director. They're talking to you as the
Yes.
facility in the state.
Yes, that's true. Any member of CASCA, you are our client, and it is our responsibility and our job to connect you to the people for whom you need to speak with, who make the decisions, who make the policy decisions, who can advocate for you. And that, that's why we're good at our job. We know the legislators, we know the people to talk to, and we're happy to introduce you to them. We're happy to set up meetings or tours or whatever the case may be because we enjoy it. That's the best part of the job, in my opinion, is the networking, getting to know people, introducing people to the legislative session, to how the legislature works, because that's the big question that most people have. How do I get involved?
Mhm.
I've never even been inside the Capitol. I don't even know what door to go in. So that's our responsibility
I've been
is
there
to,
many a times and I
yeah.
still don't know which door to go.
Is to point you in the right direction
Yeah.
and to shepherd you through the process and make it fun and make it engaging and to ensure that you know how to navigate the system. It's very complicated and it can be intimidating. But I started as a lobbyist because I job shadowed a lobbyist. And that's how I figured out that this is something that I could do.
And the value of the network is what brought you to the
That's
position that you're at now.
absolutely right.
Mhm.
Yes. Yeah.
Yep. I think that that is what lobbyists are at our core. We're good networkers. You could call it a schmoozer, I suppose, but I think it's more we're relationship people. We like to get to know people. We like to know whose kid goes to what college and who has had cancer themselves or in their family and who is interested in this topic or that. I have a common saying that politics is an art, not a science. And that's because the way you get a legislator or someone you're lobbying to agree with you is an art based on each person. It's not a specific way you do that with each and every person. So I will reiterate one of the things that Lisa said. That is our job. We are good at it. Some people I know are not natural networkers, or maybe you are a natural networker, but not in this world at the legislature. You know how to do it with the business you operate,
I,
the community you operate in.
I was about to
But
say
this is
that
a different level.
I was about to say that you're describing every salesperson listening to this was like, yeah, that's me. That's me. I'm a salesperson. That's it. No, I definitely get that. And I think the biggest takeaway from both of you on the value of the network, the value or the values of engaging with the community and those that are making moves, whether it be yourselves or Rebecca Craig, is you never actually know what path might make itself apparent until you have that conversation. I mean, that's the reality is you can speculate all you want. But if you're sitting there in a surgery center right now, you enjoy your job, but policy sounds like the thing that you might want to get into. It might be worth your time to take 5 minutes and sit down with Jennifer, or with Lisa, and talk about what's going on because you just never know what comes out of the relationships when they happen.
Yeah, I mean, I've brought countless of my clinical bedside colleagues into the Capitol, invited anyone that I work with at the clinical level to just come hang out with me. You don't have to be there all day. You don't have to be there for even half a day. You can just come for a couple hours because you've never been inside the Capitol. And when you're building relationships with legislators, we all must remember that legislators, especially state legislators, part-time legislators, if you will, are just people. They're just people, and we all find common ground. That's how we network. That's how we build relationships. That's how we connect. Because everyone, you can find common ground with anyone. And even those legislators that you don't agree with their politics, or you are opposing their bill, and you have to talk with them about, why CASCA doesn't agree with their policy initiative. There's always going to be some common ground
Mhm.
in humanity.
And one of the common grounds is almost every legislator, or at least a member of their family, has had a surgery at an ambulatory surgery center
True.
before.
I know that because I've been on the tours with you all,
Yes.
and it's something we hear all the time. But what I would say is that not all of them necessarily know how to educate others on what surgery centers.
Right. And that's where I think we come in. So we establish that commonality. Oh, you've had a surgery center surgery yourself, or someone in your family just had one 6 months ago. Had you thought about all of these policy issues that led to that surgery being able to be successful? Whether it's, insurance contracts, insurance reimbursement, a whole host of things around how much it costs that surgery center to do business, to get their license, to pass their survey, and so on
The
and
other
so
outlet
forth.
pharmacies that we were dealing with a few years back.
Right. So you bring it to And there are going to be some legislators who are experts in any topic. We've got, there's a pharmacist and a nurse in the legislature and a social worker, but there are also farmers and ranchers and lawyers who are voting on healthcare related topics. So it's up to us to translate those issues so that any legislator can understand what they mean to themselves and to their constituents and their community.
Well, I appreciate both of your times today. We thank you for the work that you do on behalf of the Surgery Center business. I'd love, it's the beginning of the year. We know from the first interview that isn't published, what was being looked forward to in 2024, but we're in 2024. Things are starting to get cooking, and I'd love to hear non-business related. What are you most excited about for the coming year that has nothing to do with work?
Oh boy, for the
How do
coming
we-
year.
It could be a
Something
vacation you have
about work.
planned after the session's done.
Yeah, I'm
Whatever.
working on planning a vacation after the session.
All
Go
right.
to Iceland and Sweden.
So not somewhere warm.
No, but it'll be in the middle of the summer, so I'll be happy to be in Iceland and Sweden when
Okay.
it's, hot as bejeez as whatever here in Colorado.
Fair enough.
And I too look forward to some travel when the session is over. I mean, during the session, we're just all about business, as you well know.
How many days are you hoping to get this season? If you still ski.
Oh no, I can't handle the traffic anymore.
Yeah. Oh, and weekdays are tough. Weekdays are tough with the legislature.
I know,
We
and I
can't
can
ski
only
during
go on
the
the
week.
weekend, so
No.
we don't really ski.
Colorado should consider, Oregon does a long session and a short session. So
Mhm.
it's every other year. And that way, those that work in Bend and represent Bend can have 1 year where they don't get to ski and 1 year where they get all their days in.
Yeah.
Right.
You never know.
Yeah, I'm a fair weather skier now too. I'm
Well,
only gonna ski when it's like blue sky and
that's fair. I've blown out my knees too many times. I stopped skiing in my early 20s and now I'm very good at après ski.
yeah.
I can bring my laptop. We can have
Great at that.
meetings. I can,
Sure. I
test
mean,
out.
just ride the lift up, ski down to the little chalet, have a cocktail,
I mean,
ride the lift back up.
for all those listening, Lisa has the plan for 2024. If you are in the mountains and you do not ski,
Yes.
follow the lessons provided. Take the gondola up, you stay warm, make your way down to the chalet, have a drink, come back down. But want to thank you both. Really appreciate the time today. And as members, keep your ears out, keep your eyes out. We have educational sessions coming this year. Our annual conference will be held at the Marriott Denver West, I believe. And we're excited about the content we're bringing forward, not only from a virtual standpoint, but in person. Please come to our events. And thank you again to the both of you. Please engage with your lobbyists, engage with your association, and we look forward to 2024.